The emergency room clock clicked from 11:36 to 11:37 p.m. as the glass doors of Mercy Bridge Medical Center slid open and let in a gust of November air. Dr. Maya Reyes stepped through with a worn canvas backpack on one shoulder and a folded set of navy scrubs tucked under her arm. The fluorescent lights were too bright after the dark street. For a second, the world became a wash of white and chrome and noise, beeping monitors, a voice over the intercom, the low murmur of nurses trading shift reports. She paused on the rubber mat just inside the entrance and let her eyes adjust. The ER smelled of antiseptic, old coffee, and rain off the sidewalk. A paramedic pushed a stretcher past her wheels, rattling oxygen tank, hissing softly. Maya shifted the backpack higher and walked toward the central nurses' station. The charge nurse sat behind the counter, flipping through a stack of charts. Her badge read, Rosa Martinez, RN. Her dark hair was pinned up in a messy knot, and a half-finished cup of coffee sat near her elbow, a ring of brown staining the paper rim. Without looking up, Rosa said, "Waiting room is that way if you are family." "I am not family," Maya said. Her voice was soft, steady. "Dr. Reyes, from the agency." Rosa's pen stopped mid-scribble. She glanced up, eyes sweeping over the backpack, the travel-wrinkled jacket, the still-folded scrubs. "The Temp," Rosa said. Maya nodded. She set the backpack down by the station and slid a manila envelope across the counter. Rosa opened it, scanned the credential sheet, the license, the assignment letter. Her eyes moved fast until they caught on a line in the CV. Field Surgeon, International Relief Organization. 6 months. Middle East conflict zone. Rosa's gaze flicked up, curious, but her voice stayed practical. "Graveyard shift," she said. "You picked the fun one." "Someone has to," Maya replied. Rosa made a mark on the whiteboard behind her, writing Reyes in neat block letters under tonight, surgery cover. She circled the name. Before she could say anything else, the door to the staff lounge swung open. Dr. Ethan Caldwell stepped out, holding a styrofoam cup that smelled of burned coffee. He still wore his white coat, but the lapels were creased and there was a brown splash near the second button. His gray tie hung loose. Purple smudges shadowed the skin beneath his eyes. He stopped when he saw Maya at the desk. "You are the Temp?" he asked. It was not quite a question. "Yes," Maya said. "Dr. Maya Reyes." She offered her hand. He looked at it, but his fingers stayed wrapped around the coffee cup. "We are backed up," he said. 2 attendings out sick, 1 on maternity leave, and whoever did the schedule hates me. You are covering surgical cases for the night. Keep it simple, no heroics." Maya lowered her hand. "Understood." Caldwell took a sip of coffee, made a face, and dropped the cup in the trash. "You can change in the locker room," he said, already turning away. "Rosa will get you a badge. I will find you when I know where to put you." He walked off down the hall, muttering something into the phone in his other hand. Rosa watched him go, then looked back at Maya with a small apologetic shrug. "He gets nicer around sunrises," she said. "Sometimes." "Good to know," Maya said. Rosa handed her a temporary ID clipped to a blue lanyard. "Locker room is down that hall, second door on the left," she said. "Restrooms across from it. When you are scrubbed and ready, come back here. Dr. Caldwell will have something for you. He always does." Maya picked up her backpack, felt its familiar weight on her shoulder, and followed the corridor past curtained bays and wall-mounted hand sanitizer dispensers. An older man coughed behind one curtain. A toddler cried behind another. The green line on a monitor pulsed in slow, steady waves. The locker room was lit by a single row of fluorescent fixtures. The light hummed quietly. Metal lockers, scuffed and dented, lined 3 walls. A bench ran down the middle. Maya chose an empty locker near the corner and opened it. The metal door squeaked. She set her backpack on the bench and unzipped it. Inside were the same things she always carried: a folded sweatshirt, a small black flashlight with scratches along the barrel, a tattered notebook thick with extra pages taped in. She touched the flashlight for a moment, her thumb resting on the worn rubber switch, then placed it carefully in the locker high on the top shelf. She shrugged off her jacket and caught a glimpse of herself in the narrow mirror by the sink. Dark hair pulled into a low bun. Tired eyes. A faint white scar near her left collarbone disappearing beneath the neckline of her t-shirt. Another pale line along her forearm, thin as a thread. Her hands were steady. She changed into the hospital-issued scrubs, pulled her hair back tighter, and tied a surgical cap at the back of her head. The fabric smelled faintly of detergent and starch. When she stepped back into the hall, the clock down the corridor read 11:44 p.m. Rosa was waiting with a stack of charts and a phone pressed to her ear. She ended the call as Maya approached. "Dr. Caldwell wants you in pre-op," Rosa said, handing over the top chart. "Or 4, first case is a college kid, appendicitis." Maya opened the chart as she walked, scanning the typed lines. Name Jason Miller. Age 19. Diagnosis acute appendicitis. Fever. Right lower quadrant pain. onset nearly 24 hours before arrival. His vitals were clipped to the back. Fever, high heart rate elevated. Blood pressure a little lower than she liked. Appendix ruptured, she asked without looking up. Radiology says maybe, Rosa said. Surgeon on call wrote him up as routine. Caldwell is sending you in. Routine, Maya kept reading. She pushed through the swinging doors of pre-op and found Jason already on the gurney, hair flattened by the pillow hospital gown tied crooked at the back. His face had the waxy gray-yellow look she knew too well. An IV line ran into the crook of his arm. His eyelids fluttered as the nurse adjusted it. At the anesthesia cart, a woman in teal scrubs was checking labels on syringes. Her badge read, Lila Nguyen, MD. She glanced up, measuring Maya in a single quick look. You must be the locum, Lila said. I am Lila. I have got him started. Nice to meet you, Maya said. How's he doing? Fever is not my favorite. BP is drifting, Lila said. But he is young. He should ride it out. Maya stepped to the bedside and laid her fingers lightly on Jason's wrist. His skin was hot damp. His pulse hammered a little faster than the chart suggested. She pressed her palm against his abdomen just above the sheet. Even unconscious, his muscles flinched. How long did he wait before coming in? She asked. According to his roommate, Lila said all day. Thought it was bad pizza. Maya nodded, then closed the chart. Let us keep him warm, she said quietly. If the appendix is gone, there is a good chance the infection has spread. Lila studied her for a second, then gave a short nod. In the scrub room, the water was warm and smelled faintly of chlorine. Maya scrubbed in with the automatic rhythm of long practice. Fingers, palms, wrists, forearms. The brush rasped softly over her skin. Soap bubbles slipped down into the stainless steel sink. She did not rush, but there were no wasted movements. When she finished, she held her hands up, elbows bent, and pushed the door open with her shoulder. OR4 glowed under bright surgical lights. Jason lay in the center of the room, blue drapes already in place, monitors arranged like a semicircle of silent witnesses. The air carried the sterile scent of prep solution in plastic. Everyone ready? Maya asked. The scrub nurse nodded. Lila adjusted the ventilator settings and looked across the table. Ready when you are, Dr. Reyes. Maya took the scalpel the nurse offered. The handle fit her grip solid and familiar. For a heartbeat, all other sounds fell away. The beeping monitors, the whisper of the air conditioner, the murmur of voices outside the door. She made the first incision. The skin parted cleanly. Beneath the layers of muscle and fascia, the inflamed mess of a ruptured appendix waited. The infection was worse than the report. There was cloudy fluid, the sharp, sour smell of sepsis. Threads of fibrin clung to swollen loops of intestine. Not routine, Lila murmured. Maya did not answer. Her focus narrowed to the field lit by the overhead lamp. Clamp, suction. She moved fast, but not hurried. Each cut opened a path, not a wound. She isolated what remained of the appendix, tied it off, removed it with a single efficient motion. Then she went to work on the damage it had left behind. She irrigated clearing pockets of pus, watching the edges of tissue grow cleaner under the stream. She traced along the peritoneum, searching for signs of spreading infection for areas that might cause trouble later. Her hands did what they had done so many times before in places far from this polished operating room. When she was satisfied, she checked Jason's vitals. The numbers had steadied, heart rate coming down, blood pressure clawing its way back up. Appendix is out, she said. Contamination cleared as much as possible. He should do well with antibiotics. She closed layer by layer, the sutures small and even. Outside the glass observation window high on the wall, a figure stood still behind the glare. Caldwell watched without moving one hand on the railing, his expression unreadable. Maya stripped off her gloves and dropped them into the bin. Warm air brushed her face as the overhead lights dimmed slightly. Her shoulders ached less than she expected. The clock on the wall read 12:18 a.m. She stepped away from the table and let the nurse move in around Jason. Nice work, Lila said quietly, for a routine case. Maya gave the smallest hint of a smile. There is no such thing, she replied. She pushed through the OR doors, back into the cooler hallway air, the smell of antiseptic replaced by coffee and floor wax. Down the corridor, the nurse's station glowed beneath its halo of monitors. Somewhere a baby cried. Somewhere else a monitor alarm chirped, then fell silent. Maya walked toward the light of the station, her temporary badge swinging against her chest, her hands already clean and steady again. The nurse's station glowed under its ring of monitors, a little island of light in the dim corridor. Rosa was there, flipping through Chart's phone wedged between her shoulder and ear. A monitor behind her showed a list of names and room numbers, each line a different story. She glanced up as Maya approached. OR4 just called, Rosa said into the phone. Yeah, he is closing. Vital stable. She hung up, then looked at Maya more directly. Kid is doing fine, Rosa said. Good job. Thank you, Maya replied. It was simple, but something in Rosa's tone had shifted. There was less distance in it now, less of the automatic skepticism. A younger nurse leaned over from the far side of the station. "They said you finished in under half an hour," she said. "On a ruptured appy, that true." Maya lifted one shoulder. "The timing matters less than the outcome," she said. The nurse grinned. "Still, for a temp, that is impressive." Rosa gave the younger nurse a light swat on the arm with a rolled chart. "Go check on bed 7 instead of starting rumors," she said, but the corner of her mouth was curved. The clock on the wall behind them showed 12:22 a.m. The steady tick of the second hand cut between the beeps and murmurs. Caldwell approached from the far end of the corridor. He had removed his white coat and rolled up the sleeves of his shirt. There was a faint red crease where his watch had pressed into his skin. He held a tablet in one hand, and his stride was purposeful, though a little uneven with fatigue. He stopped a few feet from Maya. "Our report says you opened for routine appendicitis and found a mess," he said. "Kid was septic." "Yes," Maya answered. "He waited too long. The peritonitis was localized enough. Irrigation went well. He should respond to antibiotics." Caldwell regarded her for a moment, his eyes sharper than they had been at the start of the shift. The blunt dismissal from earlier was missing. "You got all of that done in 28 minutes, he said. "That is what the clock says," Maya replied. Silence stretched for a beat. Behind him, a portable X-ray machine rolled past its wheels squeaking. "You made clean planes in dirty territory," Caldwell said. "Not many people manage that." It was as close to a compliment as Rosa had heard from him in weeks. She pretended to flip through another file, but her attention stayed locked on the two surgeons. Maya inclined her head, acknowledging the words without stepping into them. "Do you have another case for me?" she asked. Caldwell drew a breath, looked at the tablet, and tapped the screen. "I was going to take this one to the gauche hole," he said. "But since you are already scrubbed in the system and I have 3 consults waiting, I am reconsidering my life choices." He handed her the tablet. 52-year-old female, gallstones, scheduled cholecystectomy that got bumped from earlier, 3 previous abdominal surgeries, scar tissue like spiderweb. Most folks here convert to open after 10 minutes of fighting. I was planning to do just that. Maya scrolled through the chart. Past surgeries, adhesions, episodes of pain that had dragged on for years. Imaging that showed a gallbladder that looked like a small angry rock. She swiped to the scan images. The familiar gray and black patterns of organs and gas and bone filled the screen. She studied the upper right quadrant, tracing possible adhesion lines in her mind. "Laparoscopic approach is still viable," she said after a moment. Rosa lifted her eyebrows. "Radiology notes say extensive adhesions," Rosa said. "Our last surgeon tried to go in with scopes on someone like her and ended up with a 2-hour open case and a very loud recovery room." Maya looked up from the tablet. "If we plan port placement carefully and take our time with the adhesions, we can avoid a large incision," she stated. "Less pain, faster recovery." Caldwell watched her, searching her face. "You sound very sure," he said. "I know what dense adhesions look like," Maya replied. "I have seen worse with less equipment." There was nothing boastful in her voice, only a quiet statement of fact. Caldwell held her gaze for a second longer, then gave a small nod. "Fine," he said. "Or 2 is free. Dr. Nguyen will follow. Try not to make the night more interesting than it already is." He took the tablet, back-tapped a note into the schedule, and handed her the printed chart Rosa had just pulled. As Maya turned to go, Rosa caught her arm lightly. "If you need an extra pair of hands, coordinating supplies, you ask," Rosa said. "I do not feel like explaining to Mrs. Brooks's family why we kept her waiting another month." "I will let you know," Maya said. She walked toward the OR corridor, the chart tucked under her arm. The overhead bulbs buzzed softly above her. A janitor steered a mop bucket along the far wall, humming to himself. The air here was cooler, tinged with the scent of metal and disinfectant. In the pre-op bay, Mrs. Helen Brooks lay in a hospital gown, glasses folded neatly on the bedside table. Gray streaks threaded her hair. A jagged scar ran north to south down her abdomen. New proof of one of her earlier surgeries. Another horizontal scar rested a few inches above her hip. Her hands worried at the edge of the blanket. "You are not Dr. Caldwell," Helen said as Maya approached. "No," Maya said. "I am Dr. Reyes. I will be doing your surgery tonight." Helen's fingers stilled for a moment, then picked up their movement again. "I was told he usually does the hard ones," she said. "No offense?" "None taken," Maya said. "He has been here a long time." Helen licked her lips. "This is number 4 for me," she said. "They cut me open every time, said it was safer that way. Is it really safe to go in with those tiny cameras like they are planning this time?" Maya pulled a stool to the side of the bed and sat down, so they were at eye level. "Your previous surgeries left a lot of scar tissue," she said. "That makes any approach more challenging. With laparoscopy, if we go slowly and carefully, we can move between the adhesions instead of cutting a big path straight through them. Helen studied her face. And if you cannot, she asked. Then we convert to open like your other surgeries, Maya said. You will be asleep. You will not feel the difference tonight. You might feel it later when you move. But I think it is worth trying the less invasive way first. Helen searched her eyes looking for some sign of uncertainty. Have you done this before? She asked. Yes, Maya said. The images that rose in her mind were not of this hospital. A bare bulb hanging from a cracked ceiling, a metal table that rocked if you leaned on it wrong. Instruments laid out on a cloth instead of a proper tray. But the anatomy had been the same. Scar tissue did not care where it grew. Helen's hands eased their grip on the blanket. All right, she said quietly. If you think it is worth trying, then try. Informed consent is still required, Lila said from the doorway, her tone light. She had changed masks and pulled on fresh gloves. But I will back her up on that plan. Helen managed a small smile. I already signed the papers, she said. I just wanted to know whose hands I was trusting. They are steady ones, Lila said. Maya stood. We will take good care of you, she said. In the scrub room, water rushed over her fingers again. The motions were the same, but the weight of the upcoming case settled differently in her shoulders. The flash of the scan stayed behind her eyes, guiding the map she built in her head. She could see where she wanted the ports, how she could angle her instruments to slip through the webbing inside. Her hands moved through the soap and water without hesitation. Or two already hummed when she stepped inside. The laparoscopic tower stood ready, its screens dark. The scrub nurse checked the trays, counting instruments under her breath. A faint crackle sounded from the cautery unit as it powered on. Good evening again, Dr. Reyes, Lila said from the head of the table. Mrs. Brooks is asleep and dreaming of a beach somewhere hopefully far from hospitals. Let us keep it that way, Maya said. She watched as the blue drapes went up, covering Helen's scars, leaving only the planned field exposed. The old incisions looked pale against the glow of the antiseptic solution. Lines of the past cutting across the present. Port sites marked, she asked. The scrub nurse pointed to 3 small circles drawn on the skin. Maya regarded them, then shook her head. Move this 1-2 centimeters lateral, she said, touching the marker in the nurse's hand. Scar line under there is thicker than it looks. We do not want to fight it from the start. The nurse adjusted the mark without protest. Lila's eyes flicked between the monitor and Maya. You see that from up here? Lila asked. I see it from down there, Maya said, nodding toward Helen's abdomen. Her body tells the story. The first incision for the trocar was small, hardly wider than the tip of Maya's little finger. The skin gave way cleanly. Beneath it, she felt the faint resistance of scar tissue and adjusted her angle, slipping into a narrow channel where the tissue softened. The laparoscope transmitted its first image to the screen. A close view of pale adhesions, thin strands, and thick bands stretched like fibrosis spun in random directions. Silence settled over the room. Only the machine spoke. Maya rested her fingers on the handles of the instruments. On the monitor, her movements translated into delicate sweeps of metal inside Helen's abdomen. Hook cautery, she said. The nurse placed the instrument in her hand. Maya began to separate one strand at a time, creating openings, nudging loops of bowel away, exploring for a safe path toward the gallbladder. On the gallery level behind the glass, a shadow moved. Caldwell had taken his place again at the rail, eyes on the monitor, coffee forgotten somewhere outside. The second hand on the wall clock kept circling as the white web in front of Maya slowly gave way, one careful cut after another. On the monitor, the white tangle of scar tissue slowly surrendered to a pattern that made sense. Clear planes emerged where chaos had been. The gallbladder, swollen and mottled, peeked through a narrow opening like something trying to hide. There you are, Lila murmured from the head of the table. Maya did not answer. Her focus stayed on the screen. She eased the fundus of the gallbladder into view, using the grasper like a second hand guiding the first. Each move was small and precise. She freed the organ from its sticky attachments, always watching for a flash of unexpected bleeding, a hint of something vital in the wrong place. Clip applier, she said. The nurse placed it in her palm. On the monitor, 2 bright metal clips settled onto the cystic artery. Maya squeezed once. The vessel blanched between the jaws. She checked again before cutting. Artery secured, she said softly. Duct next. The duct was shorter than usual, partially hidden in an extra layer of scar, but it was there. Years of inflammation had tried to blur the anatomy. They had not erased it. She clipped and cut, then lifted the gallbladder free, guiding it slowly through the path she had opened. The organ slipped into the retrieval bag, leaving behind a bed that no longer bled. Irrigation, she requested. Clear fluid washed over the liver bed, then drained away, tinted pink at first, then clearer with each pass. No fresh red bloomed. No bile seeped from a hidden tear. "Looks clean," Lila said. Her gaze moved between the monitor and Helen's vitals. "Pressure is good. Heart rate is happy. I am happy." Maya took one more slow sweep with the laparoscope, letting her eyes search every corner they had disturbed. Satisfied, she withdrew the instruments and released the gas. The abdominal wall settled back into its familiar shape. "Closing," she said. The small port sites needed only a few stitches each. Neat, even knots sat in the skin like punctuation marks, 3 tiny sentences where one long scar might have run. The clock in the corner of the room showed 1:23 a.m. As the drapes came down, Helen's old scars came into view again. The new marks looked almost delicate beside them. "We will see you in recovery," Lila said to the sleeping woman. "You owe us a vacation story when you wake up." Maya stripped off her gloves, the elastic snapping softly against her wrists. She let the nurse take her gown. Warm air met the damp on her forearms as she stepped back from the table. Through the glass of the observation window, she saw Caldwell straighten. He had been leaning forward, one hand on the rail. Now he pushed away, a thoughtful look lingering on his face. By the time Maya left the scrub room, hairline damp under the cap, he was waiting in the hallway. The corridor outside OR2 was quieter than the main ER. The air smelled of cleaning solution and cold metal. A clock above the door marked the time with a slow, measured tick. "How did it go?" Caldwell asked. "Gallbladder removed laparoscopically," Maya said. "No conversion, adhesions were extensive, but we found a path. Bleeding controlled, no bile leak, she should do well." Caldwell let out a breath that sounded like it had been sitting in his chest for a while. "You made that look easier than it was," he said. "It was not easy," Maya replied. "Just familiar." "In what sense?" he asked. "Old, no sound." "In the sense of working with limited margin," she said. "When scar tissue has had years to grow, you cannot bully your way through it. You have to negotiate." He studied her profile. Up close like this, he could see the faint scar by her collarbone and the fine lines at the corners of her eyes that did not fit with the age on her paperwork. "You said earlier you have seen worse with less equipment," he said. "Places you worked before Mercy Bridge." Maya glanced at him, then away, as if weighing how much to give. "Have you ever tried to run a laparoscopic tower off a generator that cuts out every half hour?" she asked. "No," he said. "It teaches you to move quickly without rushing," she said, "and to remember where everything is when the lights go out." There was no drama in her voice, just memory. Caldwell folded his arms, his gaze sharpening. "How long were you over there?" he asked. 6 months, she said. 6 months of war zone cases and improvised power supplies, he said. That explains some of it. "Some of what?" she asked. He nodded back toward OR2. "The way you handle complications, Oshul," he said. "Most surgeons get tight when things are not textbook. You get quieter, your movements get smaller, but you cover more ground." She looked toward the nurse's station where Rosa was talking into a phone hand resting on a stack of charts. "I had good teachers," Maya said. She did not elaborate. Caldwell did not push. He checked his watch out of habit. The marks from the band were still faintly visible on his skin. "You have been on since 11:30, he said. 2 complex cases back to back. You need a break." "I am fine, Maya." "No, since," Maya said. "You still need a break," he replied. "Go get some water. Sit down for 10 minutes. If I find you in another OR before then, I will have Rosa lock you in an empty room." The corner of her mouth almost lifted. "I would like to see her try," Maya said. "Do not tempt her," Caldwell said. He turned away, heading toward a cluster of residents who had gathered near a computer station. Maya walked toward the small staff lounge that served as a break room. Inside, the light was softer. A vending machine hummed in the corner beside an old refrigerator covered in magnets from medical conferences. A coffee maker sat on the counter, half full of something that smelled burnt and determined. Maya filled a paper cup from the water cooler instead. The water was cool and metallic on her tongue. She sat at the small table by the window, resting her hands on the surface for a moment, palms down. The room overlooked the ambulance bay. Through the glass, she could see the empty drive damp from an earlier drizzle reflecting the red glow of a distant traffic light. The city hummed past the hospital walls, a low, constant presence. She flexed her fingers once, feeling the faint ache that came after long, delicate work. The ache was familiar. It meant the hands were still doing what they were supposed to do. The door opened and Lila slipped inside, pulling her mask down to her neck. "I thought I would find you hiding in here," Lila said. "I was ordered to hydrate." Maya said. "By Caldwell," Lila asked. "Oh," aloud. Maya nodded. "He must be impressed," Lila said, crossing to the counter for her own water. "He only tells people to sit when he wants them to last the night." "He has a way of expressing concern that sounds like a threat," Maya said. "It is part of his charm," Lila said dryly. She sat opposite Maya, cradling her cup between both hands. That was beautiful work in there, Lila said. I have seen surgeons half his staff refuse to even try lap on a patient like Mrs. Brooks. She has had enough big incisions, Maya said. If we can spare her one, we should. Lila watched her for a moment. He said you worked overseas, Lila said. Field surgeon. For a while, Maya said. Must have been intense, Lila said. Maya took a sip of water. There was less paperwork, she said. Lila laughed softly. I will give you that, she said. Before she could ask anything else, the loudspeaker crackled to life overhead. The calm recorded voice was replaced by a live one, a little breathless. Attention! Incoming trauma alert. Multi-vehicle collision on Interstate 95. 3 critical patients estimated arrival in 10 to 12 minutes. All available trauma staff report to the emergency department. The words hung in the air for a second after the announcement clicked off. Lila set her cup down, the bottom thudding softly against the table. So much for your 10-minute break, she said. Maya stood tossing her empty cup into the trash. Looks like we both got reassigned, Maya said. They stepped out of the lounge into a hallway that suddenly felt more crowded. Nurses moved with quicker strides. A stretcher rattled past, pushed toward radiology. Rosa was already walking away from the station phone in one hand, pen in the other, directing staff toward trauma bays. Caldwell met them halfway down the corridor. His shoulders were squared again. Whatever fatigue had slumped them before was pushed back for now. We have 3 coming in hot, he said. High speed on wet pavement, 1 with suspected chest trauma, 1 abdominal, 1 head. We do not have neurosurgery free. Backup is 45 minutes away. He looked at Maya. You up for more Reyes? He asked. Her eyes flicked to the clock behind him. The hands read 1:41 a.m. Yes, she said. Good, he replied. You are with me on the chest and the abdomen. Lila, you are on all 3 if we can manage it. Let us move. The 3 of them headed toward the emergency department, their footsteps matching the quickening pulse of the hospital around them. The hum of the city outside seemed to rise and meet the wail of sirens that were starting to cut through the night. The automatic doors to the ambulance bay slide open in a rush of cold night air and siren noise. 2 paramedics push a stretcher into Trauma 1 plastic wheels, rattling over the threshold. The man on the gurney looks bigger than the narrow bed can hold, his legs hanging slightly askew, boots muddy. His shirt has been cut away, chest smeared with dried blood and road grit. Male 29, the lead paramedic calls out over the commotion. Name is Luis Vega, driver. High speed into a median. Left side impact, prolonged extrication, about 40 minutes pinned. Hypotensive in the field, unresponsive to fluids. Suspected left hemothorax, maybe more. We got 1 large bore in the right, started blood. Pressure keeps dropping. Maya stands at the left side of the bed, Caldwell at the foot. Lila moves in at the head, readying the airway equipment. Nurses and techs fan out into their practice places. Luis's skin has the color of candle wax. His lips are tinged blue. Each breath is shallow, pulled in through a mask, with a faint whistling sound. His eyes flutter without focus. Masks on people, Caldwell says. Reyes, you have the chest. Lila, airway. Let us get a number. The monitor flickers alive, drawing green and red lines above the steel rail. Heart rate 130, blood pressure 80/40 and falling. Oxygen saturation a stubborn 88 despite the mask. Maya slides her stethoscope into place and presses the diaphragm against Luis's right chest, then left. Air movement on the right. Almost nothing on the left. She lifts his arm, sees bruising and swelling along his ribs. His neck veins are flat. His abdomen is still soft for now. Decreased breath sounds on the left, she says. Likely hemothorax, maybe some air. We need a tube. Caldwell, Lila says, eyes on the monitor. His pressure is not buying us time. Agreed, Caldwell says. Chest tube tray. Lila, get that airway now. A nurse pulls the tray from the wall and snaps it open. Metal gleams under the trauma bay lights. Maya takes the scalpel without being asked. She palpates between ribs, finds the right interspace, and makes a quick, clean cut. The smell of antiseptic gives way to the sharp, metallic scent of blood. She dissects down with blunt forceps, then pushes the tube in. The moment it enters the pleural space, a rush of dark red pours through the clear tubing into the collection chamber. The level climbs fast. That is a lot of blood, one of the residents murmurs. Count it, Maya says. The nurse reads the numbers as the chamber fills. 500, 800, 1200, 1500, still flowing. The monitor bleeps louder. The blood pressure drops to 70/30. Luis's heart rate spikes higher, then stutters. Maya feels the weight of the decision settle in her chest. She looks up at Caldwell. This is not slowing, she says. He has at least 1500 out of the chest more coming. Likely active arterial bleed. If we send him to CT, he will die on the way. He needs an emergency thoracotomy now. The word hangs in the room. Everyone knows what it means. Desperate measures, big cuts. No room for hesitation. For a moment, Caldwell's jaw tightens. His eyes flick to the monitor, then to the tube still filling with blood. He is right on the edge, Lila says. I have got his airway. I can keep him oxygenated a little longer, but not like this. Caldwell meets Maya's eyes. You are sure you can find it, he asks. Yes, she says. We do not have another option that keeps him alive. He nods once. All right, he says. Or 3. Now. Call it. Rosa, clear the room. We move. The stretcher jerks into motion. Hands on rails, cords lifted, the whole team moves as a single unit down the hall. Maya walks beside Luis's chest, one hand steadying the tube in its sloshing chamber. Blood taps softly against plastic with each jolt of the gurney. They burst into OR3. The room smells of fresh antiseptic and warm plastic. The lights bloom on overhead bright white cones over the empty table. On 3, Caldwell says. 1, 2, 3. They lift Luis from the trauma stretcher to the operating table. His body feels heavier than his frame should allow. Lila adjusts the ventilator tubing as he settles, eyes fixed on the waveforms on her screen. You scrub, Caldwell tells Maya. I will finish the prep. Maya nods and moves to the sink. Water rushes over her hands, hotter this time. She scrubs faster, but with the same exact pattern. Fingers, palms, wrists up the forearms. The brush rasping on her skin matches the pace of her pulse. In the background, she hears the sounds of hurried prep. The rip of paper drapes the metallic clink of instruments being laid out. Someone calls out the unit of blood hanging. Someone else repeats the count of sponges and clamps. When she steps back into the room, gowned and gloved, the left side of Luis's chest is draped in blue. The skin is slick with iodine. The chest tube still drains slower now but steady. His blood pressure hovers in the 60s. His heartline dances toward something more chaotic. Caldwell stands across from her, hands up, waiting for his own gloves. He nods at her through his mask. You lead, he says. I will assist. The scrub nurse places a scalpel in Maya's waiting hand. Anterolateral thoracotomy, Maya says. 5th inner space left. She presses the tip into the skin, starting near the sternum and drawing the blade in a smooth arc toward the side. The chest wall parts under the firm, controlled pressure. There is resistance, then a give as she cuts through muscle and intercostal tissue. Blood wells up along the incision. The smell hits her rich and hot and thick. The suction hisses as the tech moves in to clear the field. Maya feels her focus narrow to the red and the shapes beneath it. Rib spreader, she says. The nurse hands the bulky instrument to Caldwell. He hooks the arms into the gap Maya has made and turns the handle. Metal teeth ratchet open with a dull, slow grind. The ribs part, the chest cavity opens. A surge of blood spills out, pooling and then flowing toward the suction. Somewhere in the background, a resident swallows hard. There it is, Maya says under her breath. Inside the cavity, the left lung is partly collapsed purple in places where it should be pink. Blood shimmers in dark layers. The heart beats just in view, its motion sluggish but still there. Check the pericardium, Caldwell says. No tamponade, Maya says quickly. The sac around the heart looks intact. She follows the source of the fresh flow. Along one of the ribs, just under the spreader, a torn intercostal vessel sprays in rhythmic bursts. Each pulse matches the sluggish beat of the heart. Clamp, she says. The nurse slaps the instrument into her palm. Maya reaches in, feeling the heat, the slickness, the cramped space between bone and tissue. She finds the vessel with the tips of the clamp and closes down on it. The spray stops. The suction changes tone from frantic slurp to steady draw. The pool of blood shrinks. On the monitor, the blood pressure creeps from 60 to 68, 70. The heart rate slides down a few points. That is better, Lila says quietly. Maya holds the clamp steady while Caldwell places a ligature around the vessel. His hands are strong and practiced, but he glances at her once with something like respect. They tie off the artery, double knotting it before removing the clamp. No new bleeding appears from that site. Check the lung, Maya says. She runs her gloved fingers gently along the surface of the left lung, feeling for lacerations. She finds 2 small tears near the lower lobe. With fine sutures, she closes them, careful not to constrict the tissue too tightly. The lung looks less ragged, more whole. Chest tube is in a decent position, she notes, eye on the tubing. We will keep it. It should handle the rest. She sweeps her hand once more through the cavity, checking for any other surprises. Satisfied, she looks up at the monitor. Blood pressure 85/50. Heart rate is steadier 110. Oxygen saturation 94 and rising. Luis's face still looks pale, but there is a little more color at the edges of his lips. Stabilizing, Lila confirms. He's not winning any races, but he is moving in the right direction. Pack and close, Caldwell says. They place a few sponges to keep gentle pressure where it is needed, then begin to approximate the ribs. The retractor comes out with another slow grind of metal. Maya closes muscle and skin in layers, leaving enough room in the plan to explore again if he starts to bleed later, but tight enough to protect him. By the time the last stitch is tied, the clock on the wall reads 2:49 a.m. Maya steps back. Her shoulders ache now more than before. A thin line of sweat cools at the base of her neck. She peels off her gloves. Her hands are marked faintly red at the wrists from the pressure of the cuffs. "Get him to ICU," Caldwell says. His voice holds something new, a note of relief that matches the numbers on the monitor. Continuous monitoring. Keep the blood warm and the family updated. The team moves into motion again, reversing the earlier steps. Lines, secured tubes tape the ventilator switched back to transport mode. The stretcher appears at the side of the table, ready to receive him. As they transfer Louise, Maya catches a glimpse of his hand dangling off the edge for a moment. It looks large and calloused, stained near the nails. Someone tucks it back onto the mattress under the blanket. Then he is gone, rolled back through the doors and toward the elevators. The room quiets. Only the hum of the vents and the soft buzz of the lights remain. The smell of blood lingers under the antiseptic. Caldwell pulls off his own gloves and drops them in the bin. He looks at Maya across the table. "That was the right call," he says. "You got it," he says. "You saved his life in there?" "I did my job," she says. He studies her face as if trying to reconcile the calm tone with what he has just watched. "Rosa is paging us," Lila says from the doorway. Her mask hangs at her neck, her hair frizzed slightly from sweat. "Second trauma is here. Abdominal. It looks bad." The clock over the door ticks past 2:51 a.m. Maya breathes in the metallic air, once lets it out, and turns toward the hall. The hospital has not slowed. The hum in the walls feels louder now, as if the building itself has taken a deeper breath. Trauma 2 was already crowded when they reached it. Another stretcher had been rolled in from the bay, this one carrying a woman in her 30s. Her blonde hair was streaked dark, where blood had dried at the roots. Her t-shirt had been cut up the front. The fabric clung to her skin, soaked with a deeper red across the lower ribs and abdomen. "Female 36, Bariste." "Sam Focus," the paramedic announced. "Name is Claire Donovan. Front seat passenger, same crash. Unrestrained. Steering column to the belly. Hypotensive in the field, got 2 units on the way in. Abdomen rigid distended, no CT yet. She tanked as soon as we hit the ramp." The smell of blood and gasoline clung to her. Maya moved to Claire's right side. Caldwell took the left. Lila was already at the head, checking the airway, calling for more blood. Claire's eyes were half-open, pupils sluggish. Her lips moved, shaping words that never quite formed a sound. "Blood pressure?" Caldwell asked. 74/30, a nurse said. "Heart rate 140, cool extremities. She is not perfusing." Maya lifted the edge of the sheet. The abdomen was swollen, the skin taut and shiny. Purple bruises spread like storm clouds across her flanks. When Maya placed her palm on the belly, there was no give, only hard resistance. "She is bleeding into her abdomen," Maya said. "A lot." Caldwell nodded once. "Fast?" he asked. "Positive in Morrison's pouch and pelvis," the resident with the ultrasound said. His voice shook a little. "There is free fluid everywhere." "No CT," Maya said. "She will not survive the trip." "I agree," Caldwell said. He looked at Lila. "Can you keep her with us?" "I can try fuck'ems," Lila said. Her hands moved quickly, adjusting drips, calling for vasopressors and more blood. "She's on the edge." Caldwell turned back to Maya. "She needs an immediate laparotomy," he said. "We are out of time for discussion." Maya met his eyes. "I will take it," she said. There was no hesitation in his reply. "Or one," he said. "Move her." The team swung into motion. Hands gripped rails. Lines were kept clear. The stretcher rattled down the hall, bumping slightly over thresholds. Maya walked beside Claire's abdomen, one hand resting lightly on the sheet, feeling the unnatural firmness beneath. The corridor seemed narrower, the lights harsher. Somewhere down another hallway a phone rang without being answered. In OR1. The staff worked with a speed that came from habit. The table was ready, the instruments laid out like notes in a familiar song. The smell of antiseptic fought with the copper tang that followed Claire in. "On 3, Caldwell said. 1, 2, 3. They lifted her to the table. Her skin felt lighter than Luis's, but there was a heaviness all its own in the way she did not respond to the move. "Reyes scrub," Caldwell said. "We do not have minutes to waste. Lila, keep her heart beating." Maya moved to the sink again. The repetition did not dull the urgency. Water soap brush. The pattern was the same, but her mind was already at the table, tracing the incision she needed to make planning the first packs. Inside the room, she could hear Lila's voice calm and firm. "Pressure is 60/20. Get me the next unit ready. Push calcium. I want warm blood in her, not ice." When Maya stepped back through the door, gowned and gloved, Claire's abdomen was already painted yellow, with antiseptic from chest to pelvis. The monitors above the table showed numbers she did not like. Midline laparotomy, Maya said. Her voice was steady. The scrub nurse placed a long scalpel in her hand. The handle felt heavier now. She found the midline with her fingers and pressed the blade in just below the xiphoid. The skin opened under the firm line of the cut. She drew the incision down in one continuous motion to just above the pubic bone. Blood welled up along the cut darker than the prep solution. The smell thickened. She set the scalpel aside and reached for the cautery. "Retractors," she said. The nurse and Caldwell slid in the metal arms, pulling the edges apart. As the peritoneum opened, a warm rush of blood spilled out, filling the wound and running down the sides of the table into the suction. The sound of the suction changed a low gurgle as it tried to keep up. "That is at least 3 liters, someone whispered. "Pack all 4 quadrants," Maya said. She took laparotomy pads and shoved them deep into the belly. One to the right upper quadrant, one to the left, one down into the pelvis, another across the mid-abdomen. Her hands moved fast, disappearing almost to the wrist in the cavity. "Get me more," she said. The nurse passed them. She packed until the flow slowed, until the field was less of a lake and more of a river with banks. Only then did she begin to remove the pads one by one, starting in the right upper quadrant. When she pulled the first pack back, new blood surged from beneath a contused chunk of liver. "There," she said. The liver was torn along its edge, a jagged line that opened with each shallow breath. Blood oozed and pulsed from multiple points along the tear. "Pringle," Caldwell said. Maya had already placed her hand on the hepatoduodenal ligament. She felt the structures beneath the smooth, firm shapes of artery and vein and compressed them gently. The bleeding slowed. "That buys us a little time," she said. "Suction. I want to see the edges." The suction cleared the pooled blood. Underneath, the laceration came into view, running across several segments of the liver. Some parts were shallow, others deeper, probing toward vessels she did not want to expose. "She hit hard," Caldwell said. "She's still hitting," Lila said grimly. "Pressure 55/20. I need you to give me something to work with." "Working on it," Maya said. She chose the worst area first. With a fine needle, she began to place deep stitches looping through the liver tissue to bring the edges together. Her hands were firm but gentle. Too much force and the fragile parenchyma would tear. Too little and the bleeding would continue. The room narrowed to the sound of the suction and the soft hiss of the ventilator. The rest of the world fell away. The lights were too bright, the air too dry. Her gloved fingers moved with the surety of long practice making decisions that could not be reversed. As she tied each knot, she watched the oozing slow then stop. Where the sutures were not enough, she laid small pads and pressed, letting the liver show her what it needed. "Pressure is creeping up," Lila said. 60, 65, keep going." They removed the packs from the left upper quadrant. The spleen was bruised, its capsule stretched but mostly intact. A small tear along the edge oozed slowly. "Spleen is injured but not shattered," Maya said. "We can salvage." With more sutures and a few well-placed pledgets, she coaxed the bleeding to a halt there as well. In the pelvis, the packs came out tinged but not soaked. No obvious large vessel bleed. The small bowel had a few contusions, one small mesenteric tear that she repaired with quick stitches. Each fix added up a tally against the blood spilled earlier. "How is she now?" Maya asked without taking her eyes off the field. 75/40, Lila said. "Heart rate down to 120. She is not out of the woods, but she is no longer free falling." Maya released the compression on the portal structures, slowly watching the liver with almost physical attention. A little oozing resumed along one edge. She added another stitch, another gentle press. The oozing slowed again. They irrigated the abdomen. The fluid came back tinged but not fresh red. "No ongoing major hemorrhage," Maya said. "We can leave some packs near the liver for added support. They can come out later." "Agreed," Caldwell said. His voice held real approval now. "You turned a disaster into something survivable." Maya did not answer. Her hands were already closing the fascia needle, moving in a steady rhythm down the length of the incision. The skin followed, brought together with a careful, efficient line of staples. The clock on the wall read 3:38 a.m. Her shoulders burned. Her lower back ached. A bead of sweat ran down between her shoulder blades, trapped under the gown. She stepped back only when the last staple clicked into place. "Get her to ICU," Caldwell said. "Blood products close monitoring. She bought herself another chance." The staff moved in around Claire. Lines were secured. The ventilator tubing was adjusted. Someone smoothed her hair back from her forehead, wiping away dried blood with a gloved thumb. As the stretcher rolled out, Maya watched it go for a moment. Then she peeled off her gloves. Her hands inside were pale, the skin wrinkled from repeated scrubbing. They trembled slightly at the fingertips. She flexed them once slow until the tremor faded. The room felt suddenly too quiet. The overhead speaker crackled. Rosa's voice came through, clipped and tight. Dr. Caldwell, Dr. Reyes, we need you back in the emergency department. Third trauma patient is here. 16-year-old male, severe head injury. CT shows acute subdural hematoma with midline shift. Neurosurgery is still scrubbed in upstairs. Backup is 45 minutes away. Caldwell and Maya exchanged a brief look. There was no time to name the fatigue in their faces. Let us go, Caldwell said. They stepped out into the hallway again. The lights seemed harsher now. The clock outside OR 1 showed 3:41 a.m. The second hand kept moving indifferent. The hum of the hospital wrapped around them as they walked toward it. Trauma 3 was colder than the others. The curtains were half drawn when Maya and Caldwell walked in. A boy lay on the stretcher neck in a collar head, wrapped in gauze that had already turned rusty near the temple. His hospital bracelet was too big for his wrist. It slid back and forth when the nurse checked his pulse. 16-year-old male, Rosa said at their shoulders. Name is Noah Price. Rear seat no belt, thrown forward, lost consciousness at the scene, GCS 6 on arrival, pupils unequal. We got a CT before he crashed too hard. She held out a film jacket and a printed report. Caldwell took them and flipped them open. Grainy images stared back. Blood pooled along one side of the brain, a crescent of white pressing the darker tissue inward. The center line of the brain was shifted far from where it belonged. Acute subdural, so Caldwell said. Significant midline shift, brainstem compression. Noah's chest rose and fell under the ventilator's rhythm. Each breath sounded louder than it should in the tight room. Neuro is scrubbed in upstairs, Rosa said. They cannot break. Backup from across town is at least 45 minutes out, likely more. Noah's left pupil was blown wide, barely responsive to the penlight. The right was sluggish. His hands lay limp at his sides, fingertips pale. Lila stood at the head of the bed, one hand on the ventilator tubing, the other adjusting the drip rates. Pressure is creeping down, she said. ICP is going up. Mannitol is in head of bed up. We are pushing every medical trick we have. It is not enough. Caldwell looked at the scan again, then at Maya. If we wait, he herniates, he said quietly. If we do nothing, he dies. Maya studied the images. The arc of blood, the compressed ventricles, the bowed midline. She felt the hospital around her, the hum of lights, the faint echo of footsteps in the hall. The clock above the sink read 3:49 a.m. He needs a decompressive craniotomy, she said. We do not have neurosurgery, one of the residents protested. His voice came out too loud, cracking at the end. We are not set up for this. We have a drill arrangeur and enough skill to follow the anatomy, Maya said. Her tone stayed calm. If we wait, we watch him die and tell his parents we stood by with our hands in our pockets. Silence followed. The only sound was the ventilator's soft push and the beep of the monitor. Caldwell held her gaze. Have you done one before? He asked. Not in this building, she said. She saw again a concrete room lit by a single bulb. A boy, not much older than Noah, dust in his hair, blood pooling under his ear, a drill that did not belong in an operating room but went through bone all the same. How that night had ended was stitched into her hands. Caldwell did not ask for more. Or 4, he said. Now, Rosa, get the cranny tray. I want every brain bucket and aneurysm clip we own laid out. Lila, keep him as stable as you can. Reyes, you are lead. There was no time for fear. The team moved in a tight circle around Noah, pushing the stretcher out of the bay and toward the elevators. The fluorescent lights strobed overhead as they went blinking over blue drapes and white bandages. In the elevator, there was just the soft hiss of oxygen and the ticking of the floor numbers. Caldwell watched the monitor. Maya watched Noah's face. The bandage pressed under his jaw, his mouth slightly open around the tube. He looked younger than 16, lying flat like that. Or 4 had been turned over fast. The staff worked with a kind of quiet intensity that fit the hour. The craniotomy set lay open, gleaming under the lights. The air smelled of antiseptic and warmed blankets. On 3, Caldwell said. 1, 2, 3. They slid Noah onto the table. Lila checked the tube, securing it at the right mark. A nurse shaved the hair from the right side of his head in quick, efficient strokes, exposing pale skin beneath. Mark the flap, Maya said. The resident with the marker drew the classic question mark shape over the temporoparietal area, guided by her finger. She adjusted his mark twice a fraction of an inch this way and that. That is where the clot is heaviest, she said. We give ourselves enough room. In the scrub room, she washed her hands yet again. The heat of the water felt almost punishing now. She scrubbed anyway every finger, every nail, every inch of skin she would bring near his brain. Her reflection in the stainless steel was brief. Cap mask eyes darker from long hours, her hands steady when she held them up to dry. Back inside the field was draped. The only visible part of Noah was the oval of his exposed skull already painted orange. The lines of the marker stood out on the skin. Lila? Maya asked. Pressure is hanging in the 60s, Lila said. Heart rate 110. He is right on the edge. Then we move, Maya said. The scrub nurse placed the scalpel in her hand. Maya incised the skin along the inked line, cutting through scalp rich with tiny vessels. Blood rose in quick beads. The nurse dabbed them away with gauze and applied small metal clips to the edges. She dissected down to bone, exposing the pale curve of skull. The air changed. It felt closer, heavier. Cranial perforator, she said. The drill whirred as the nurse tested it, then placed it into her palm. The sound was higher pitched than the drill she had used overseas, but the feel of it in her hand was the same. Maya positioned the tip at the first point along the flap. She centered it, braced her wrist, and squeezed the trigger. The vibration traveled up her arm. Bone dust, fine and white, collected along the edges. The built-in safety released as the bit broke through into the space beneath the sudden lack of resistance, shifting the tone. She lifted the drill away. 1, the nurse said, marking it on the count sheet. 3 more burr holes followed in an arc. Each time the whine of the drill rose and then dropped as it reached the diploic layer, and then the inner table. Each time white dust smeared against orange skin. Rangeur, Maya said. With careful bites, she connected the holes, turning 4 points into a single bone flap. A thin line opened between skull and dura. She eased the flap free, lifting it away and handing it off to the waiting nurse. Beneath it, the dura bulged purple and tight. ICP is high, Lila murmured. Maya made a small incision in the dura. It split. Dark, partially clotted blood rushed out thick and heavy, spilling over her gloves and down into the suction. The brain beneath relaxed, the bulge subsiding a few millimeters. The monitor chirped. Blood pressure edged up a notch. Heart rate slid down 2 points. Pupils, Caldwell asked. Left is still slow, but it is reacting a bit more, the resident at the head of the table said. Maya widened the dural opening, letting more clot escape. She scooped it gently with a small spoon, guiding it toward the suction. Behind the clot, she saw the pale surface of the cortex, less compressed now, but still tight. A bright red well appeared at the edge of the field, pulsing in a way that did not match venous ooze. There, she said, middle meningeal. Coagulation, the nurse said, handing over the bipolar. Maya touched the fine tips to the bleeding point. The current hummed softly. The red flicker dimmed, then went dark. She waited a heartbeat, watching for any renewed surge. None came. Bleeding controlled, she said. They irrigated the field with warm saline. The fluid ran clear. The brain rose slightly toward the opening, but not as angrily as before. It seemed to breathe again. ICP is down, Lila said. There was relief in her voice she did not try to hide. Blood pressure 90/50, heart rate 95, oxygen is good. Maya placed a dural substitute patch over the gap, leaving room for the swollen brain to expand. She did not replace the bone flap. Instead, she secured it in a sterile pouch to be dealt with later. Leave it off for now, she said. He needs the space. They closed the scalp over the opening, bringing the skin together over the soft curve beneath. Staples clicked along the incision, bright silver against pale skin. When the last one was in place, Maya stepped back. She looked at Noah's face. It was still more peaceful than it had been in the trauma bay. His chest rose and fell in smooth, mechanical rhythm. Get him to neuro-ICU, Caldwell said. Slow transport. Watch the lines. The team set about their tasks. Monitors were rearranged. The ventilator was switched to portable. The bed was raised, then unlocked. As they began to wheel him away, Maya reached out and briefly touched the back of his hand where it lay on the sheet. The skin was warm. His fingers twitched once, barely more than a ghost of movement. Then he was gone through the door, swallowed by the corridor. The room emptied. The hum of the overhead lights filled the space where voices had been. The clock on the wall showed 5:07 a.m. Maya peeled off her gloves. Her hands were damp and flushed. Red indentations circled her wrists where the cuffs had pressed. She flexed her fingers again. The ache ran deep, now settled into bone and tendon. Caldwell stood at the far side of the table, mask hanging at his throat. He watched her for a moment, something heavy and complicated in his expression. You just did work I usually see at a university neurosurgery conference, he said, without a neurosurgeon in the room. I did what was needed, she said. Where did you learn that? He asked. She wiped at a streak of bone dust on her sleeve that the scrub nurse had missed. Some places do not have subspecialists, she said. You either learn quickly or you watch too many young people die. His jaw moved as if he was about to say something else, then stopped. He let out a breath instead. 3 critical traumas, 2 complex abdomens, 1 chest, 1 brain, and an infected appendix in the middle, he said. Most surgeons would be on the floor by now. I have sat down at least twice, she said quietly. He almost smiled. Go write your notes before you forget the details, he said. Then get some air. Sun rises in less than an hour. It is almost a different planet out there. She nodded once and left the room. The corridors were calmer now. The frantic edge had worn off, leaving a hum of steady work in its place. An orderly pushed a cart of fresh linens. A resident leaned against a wall, eyes closed, coffee cooling in his hand. At the nurse's station, Rosa sat with 3 charts open in front of her. She looked up as Maya approached. "ICU called on your patients," Rosa said. "The kid from the appy is sleeping. Mrs. Brooks is groggy and complaining, which is a good sign for her. Luis and Claire are both still critical, but the numbers are better than when they rolled in." "And the boy, Maya?" Maya asked. "Noah," Rosa said. "He is holding. That is what they said, holding." Their eyes met for a second over the stack of paperwork. "You did something tonight," Rosa said. Her voice was softer than usual. "A lot of somethings." Maya lowered her gaze to the blank operative reports waiting on the counter. "There is still documentation to do," she said. Rosa almost laughed. "Of course," she said. "Heaven forbid the paperwork rests." Maya filled in the forms. Black ink on white paper, measured exact. No drama, only facts. Incision lengths, estimated blood loss. Steps taken. Complications avoided. Each report told the story in a flat voice that did not match the feel of blood under her hands or the weight of the choices in the room. By the time she signed the last one, the clock above the station read 6:32 a.m. Outside the narrow window at the end of the hall, the sky had begun to lighten from black to deep blue. A smear of pink hovered at the horizon. Caldwell found her there standing by the window with her hands tucked into the pockets of her jacket. She had changed out of her scrubs. Her hair was down damp where she had splashed water on her face. "Rounds will be interesting today," he said. "I imagine so, Shikawae." She replied. He hesitated, then stepped closer. "I want to talk to you about something that he said. Your contract is for how long?" "Just tonight," she said, "a single shift." "Then the agency is about to get a very long call from me," he said. "I want you on staff, not as a temp, not as backup, as part of this place." She turned her head, studying his face as if she were assessing another patient. "This hospital has its own people waiting for more hours," she said. "Residents hoping for attending spots, fellows lining up for contracts. They did not do what you did tonight," he said. "You belong in an operating room, not bouncing from hospital to hospital like a rumor." Maya looked back out the window. A delivery truck rolled into the side lot, headlights dim in the growing light. "I am not sure I belong anywhere," she said gently. He opened his mouth, then closed it again, pushed his hand through his hair, leaving it more rumpled than before. "At least stay long enough for me to make the offer properly," he said. She did not answer. A call came over the overhead speakers summoning him by name to the ICU for morning rounds. He looked toward the sound, then back at her. "I have to go," he said, "but I will find you after. Do not disappear on me." "I will finish up here," she said. He left his steps already speeding toward the next task. When he returned to the station an hour later, the sun was up. Pale light filtered through the high windows, softening the sharp edges of the monitors and the counters. Rosa was still there, but the chairs around her were filled with new faces, day shift nurses taking reports. Maya's name remained on the whiteboard, but a small line had been drawn through it in red. "Where is she?" Caldwell asked. Rosa glanced up. "Who?" she said. "Reyes," he said. "Dr. Reyes, the agency surgeon. Where is she?" Rosa nodded toward the far end of the hall. "She signed out 30 minutes ago," she said. "Left this for you." She held up a folded piece of paper. Caldwell took it and opened it. In small, neat handwriting it read, "Thank you for the opportunity to work with your team. They are very good at what they do. Take care of them. M. Reyes." No contact number, no forwarding address, no demand, just that. Caldwell looked toward the automatic doors at the end of the corridor. From here he could see only a slice of the world beyond. Morning traffic moved past headlights fading in the new light. A person in a gray jacket crossed the driveway, head bowed against the chill, then turned the corner out of sight. He folded the note and slipped it into his pocket. Behind him monitors beeped. Voices rose and fell. Somewhere a patient laughed weakly at something a nurse had said. The hospital carried on its rhythms unchanged, but the night left a trace in its walls. Caldwell picked up the first chart from the stack and turned toward ICU hands, already reaching for the next life that needed tending. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.